Hi, this is Vic, and the reason I'm doing this video is because in 2007 I was diagnosed with prostate cancer. After having my annual physical in 2007, the blood work results the blood work indicated that there was something wrong with my prostate, and it could be prostate cancer, not that it definitely was, and further testing was required. So my family physician who found the abnormal blood referred me to a specialist. He referred me to a surgeon. Guess what the surgeon recommended? You got it, surgery. Now, after doing some research on the internet, again, this was in 2007, I did some research on the internet to find out if there was any way to battle prostate cancer without surgery. And what I kept running into was something called the CyberKnife. And I asked that specialist or that surgeon about the CyberKnife. He didn't know, well, he did know a little bit about it, but he didn't know enough about it to answer my questions in any type of detail that would satisfy my curiosity. My impression was he wanted to do the surgery, and that was it. That was my impression. But at any rate, after I continued to research it, I found out there was a hospital 20 miles away from me that had a CyberKnife facility in it. I made an appointment. I contacted the CyberKnife facility in that hospital. I made an appointment to speak with the doctor. We cleared up some things, and he said that after further examination that I was a good candidate for CyberKnife treatment. He could effectively treat me if I wanted to be treated without surgery. I said, well, doc, yes, that's why I'm here. Hell yes, I want to be treated without surgery. So, in a nutshell, I'll give you a nutshell of what my treatment was like. My treatment plan went like this, and it's going to vary depending upon the severity of the cancer and other physical characteristics. But my treatment plan was like this. For 5 days in a row, I would lay down on a bed for 45 minutes on my way to work. That's right, I drove to work every day during my treatment. And my treatment plan was to last for 5 days consecutively, for 45 minutes each day, and everything went according to plan. And surprisingly, there was no interruption between my wife and I in our intimate lives. My doctor told me that he wasn't going to place any limitations on what I could or could not do. If I had the physical ability to do something and it didn't cause any discomfort, he said I could continue it. And I did exactly that. So it was bad that I had prostate cancer, but it was truly a blessing to find the CyberKnife. That's the way I feel about it. And also, the screen that you're looking at right now is as a result of hearing about men periodically. After I was treated by the CyberKnife, every once in a while I would hear about men where their doctors recommended surgery for them. So I decided I was going to, every once in a while, put out a video to spread the word about the CyberKnife, because apparently people that are working in the medical area and doctors aren't fully knowledgeable about the CyberKnife. So my goal is to educate everyone. The more we know, the better prepared we are to fight this prostate issue. Because as we get older, we're going to eventually get prostate, possibly. And in this video, you will see video snaps from CyberKnife.com, the makers, or from Accuray, the makers of the CyberKnife, and their website, CyberKnife.com. I will play some videos that are from doctors and medical professionals that work with the CyberKnife. And they will talk specifically about statistics and all that stuff. Okay, so now I am at CyberKnife.com, and I will go ahead and start to play the doctor videos. And after those videos, then I will show you how you can navigate their website and find a CyberKnife facility based on your location. So I'm going to click on Resources, and I'll click on Videos. And first we get to the prostate cancer section. And CyberKnife treats other things besides prostate cancer. Coincidentally, prostate was the first thing that we ran into on the screen, but it does other things besides prostate. It also treats brain tumors, brain cancers, and spinal cancers and tumors as well. Prostate was one of the last things, my understanding is, prostate was one of the last things that CyberKnife was approved to treat. But anyway, we'll go ahead and play the first video.
Treating prostate tumors with radiation or surgery is challenging. The prostate's proximity to other sensitive organs, like the bladder and rectum, require pinpoint accuracy to avoid damaging healthy tissue and nerves. CyberKnife, the first and only robotic radiation system. Using advanced imaging and real-time motion synchronization, the CyberKnife system continually adjusts to your prostate's unpredictable movements, allowing this non-surgical treatment to deliver high doses of radiation precisely to the prostate in only 4 to 5 sessions, generally in just 1 week, compared to as many as 45 with traditional radiation therapy over 9 weeks. Traditional radiation therapy systems do not automatically adjust to movement. The radiation is therefore targeted at an area that overlaps with nearby healthy tissue and organs to ensure that the prostate is always covered. This requires lower doses per session to spare the healthy tissue, and therefore many more trips to the radiation therapy center. Surgical procedures for the treatment of prostate tumors require a hospital stay and risk surgical complications, such as infection, incontinence, and a painful recovery. The CyberKnife system uses X-ray imaging to track the prostate's unpredictable movements by continually adjusting the radiation beam with its robotic arm to target the prostate with high precision and accuracy without any surgical cuts. Not only does this mean no overnight hospital stay, but it allows for short treatment and recovery time. The sub-millimeter accuracy with which the CyberKnife system delivers radiation to the prostate can also be applied to tumors of the brain, head and neck, spine, lung, breast, liver, pancreas, kidney, and more. The CyberKnife system is clinically proven and has been used to treat thousands of prostate cancer patients. It is also safe and effective when used in combination with a variety of other techniques, giving new hope for patients with recurrent tumors, even those which have previously received radiation. The CyberKnife system delivers precise robotic treatment as individual as every patient. Visit www.cyberknife.com for more information and speak with your physician to find out if the CyberKnife system is right for you.
Okay, go on to the next video.
They don't feel anything during the treatment. There's no discomfort. Some of our patients just listen to music on a headset while they're being treated.
It's a tool that fits into the armamentarium of how we already treat patients.
As a surgeon, I want to ensure that we are really delivering our patients surgical-like precision and making sure that we're trying to minimize their side effects and yet still delivering them an effective cancer procedure. One of the advantages of the CyberKnife technology is its ability to really track even sub-millimeter movements.
That technology doesn't exist with other modalities of radiation.
So instead of putting a 20 millimeter margin around the prostate, we typically put about a 3 millimeter margin around the prostate. So we're radiating less of the bladder, less of the rectum, and we're able to give the radiation much faster in 5 days as opposed to 9 weeks.
After the treatments are over, patients can go back to any activities they want, whether they go back to work, go on a vacation, and that's one of the real attractions of patients is I've had patients having to go to Europe the following week, and they're able to do that after the CyberKnife treatment.
And the nice thing about the CyberKnife, in contrast to our conventional radiation, is that since we're giving the radiation so much faster, by the time the side effects have kind of come and gone for our regular radiation treatments, they would just be starting for the other forms of radiation.
We now have data emerging from research studies that's showing that the side effects from CyberKnife for prostate cancer are less than those seen with external beam, with seed implants, and with proton beam radiotherapy, while the biologic dose that we're delivering is as good or better than any of these.
A lot of our patients are candidates for surgery, and they choose to have CyberKnife because they don't want to go to the operating room if they have another alternative that is as good or better even.
The most commonly recommended treatment for addressing early stage prostate cancer is the radical prostatectomy. And while it's an effective treatment, there are some potential long-term side effects from it. Some patients end up with incontinence. Probably over half of patients end up with erectile dysfunction. It's a major surgery. Even if one performs a robotic prostatectomy, the incisions are smaller, but still the surgeon has to cut out the prostate.
So there are the patients that can't have surgery. There are patients that have already been radiated once and we can retreat them. And then there are patients who just don't want to have more aggressive therapy, particularly our older patients. So it's not unusual at all for me to treat a person in their 80s or 90s. Not unusual. That's an everyday thing for us.
But I think it's important, and it's our job as physicians to make sure that our patients have all the options available to them, especially if there may be an advantage to them. And we believe that with this technology, there may be a real advantage, particularly in the short course in which they can be treated for their prostate cancer.
We're thinking about treating cancer in totally different new ways, and it's no longer one size fits all. Everything is individualized and tailored to the individual in which you offer them and how you go about offering them the treatment, and it's really an exciting time to be practicing radiation oncology.
Now, in that last video, the doctor recommended robotic surgery. And yes, they are making smaller incisions, like he said, but they're still cutting a hole in your body. And at the time, I was 57 years old, and my wife and I were living full, normal lives. And I prefer to not let that be interrupted by volunteering to let somebody cut a hole in my body. But at the same time, I still want to be treated effectively, and the CyberKnife treated me effectively without being cut open. So on to the next video.
We had two primary objectives in this study. One was to show that CyberKnife SBRT for prostate cancer was safe. The second objective was to show that cancer control rates were good, in fact, better than historic controls. We got 21 centers together, and we treated 309 patients with low and intermediate risk prostate cancer. We followed them for over 5 years. What we found is the side effects from treatment were unusually low. Fewer than 2% of patients had significant side effects from treatment. The cancer control rate was exceptionally good. At 5 years, 97% of patients were free from cancer progression. If we look at the low-risk group of patients, 97.3% were free from cancer recurrence. And when we compared that against historic controls, in other words, the results that we see with conventional IMRT, this proved to be superior. We also looked at outcomes in intermediate risk patients. These are the patients that are at greatest risk of dying from prostate cancer. And we found that about 97% of those patients were free from cancer recurrence 5 years later. This is significantly better than what we see with IMRT, and in fact it matches the best cancer control rates that have been published with radiotherapy for prostate cancer. One of the good things about this study is we followed the average patient for over 5 years, and we have some patients we've been following for 7 or 8 years. And we're seeing excellent results even with this prolonged follow-up. Suddenly we're able to deliver the best cancer control rates with fewer side effects and treating patients in only a week. So I think my colleagues will see this and realize that this is a compelling way to treat prostate cancer. Having the CyberKnife platform has been really important for my practice, but more so for my patients, because we now have this device that can target cancer with exquisite accuracy. We're seeing exceptionally good cancer control with low toxicity and short treatment course. It's great for patients. It's a home run. So I think it's going to change the way we treat prostate cancer.
Okay, in the last video that I will show you before I show you how to find a CyberKnife facility, how to search for a facility across the country, the last video I will show you before I show you that will be a patient testimonial.
When I would climb into this airplane, I knew that there was no one else better on the earth at flying this airplane. I could take on any adversary and be successful. I graduated from Top Gun in 1986.
No, it looks okay, Bing.
And they called me Bing, as it goes along with my name, Bing Crosby. Going twice the speed of sound, pulling 8 or 9 Gs is just feelings that are unmatched. Life did come to a stop. You never expect to hear those words in your life. As much as you can prepare for it, you never expect that it's going to be you.
About 1 out of 7 men will be diagnosed with prostate cancer. We have an excellent way to screen for prostate cancer. It's called the PSA blood test, the prostate-specific antigen. We can usually detect prostate cancer when it's still curable.
The VA won't check your PSA unless you, as a patient, ask for it. So I did get a PSA check.
Now that hurts my feelings. It really aggravates me. He said the VA won't check your PSA unless you specifically ask for it. If that is the case, the next time I go to the VA clinic, my VA clinic here in Charlotte, I'm going to ask them if they're checking my PSA. Because if they are not, then what they are doing, in my opinion, is sentencing men to die a slow, painful death when they don't have to. Because of this, and actually, on top of that, it also shows how ignorant they are of the good technology that we have in the CyberKnife in treating prostate cancer. By the way, one of the things that my doctor, who is not associated with the VA, told me that some organizations will not, some insurance companies will not pay for PSA screening because if you test positive, guys, a lot of times they don't get treated because of the painful side effect, the painful surgery that they have to go through. So therefore, a lot of companies won't pay for it. Maybe that's the motivation behind the VA not checking PSA.
Before they recommend a biopsy. When I found out what my current number was last October, it was 14.6. It's that moment, those lovely 3 words, you've got cancer.
So you can come in here, sir, and just have a seat here and lie back with your head up here.
I took it as almost another mission. Your body is eating itself up. What weapons can you employ to actually take on this enemy that's now inside your body?
We'll start aligning you up to our target there. You'll feel the table move a little bit.
The most effective weapon was the CyberKnife.
The CyberKnife is the most advanced radiation device for precisely delivering radiation to a specific target in the body. It uses robotic technology to identify where the prostate is, and if there's any motion, it adjusts for it and treats with under a millimeter of accuracy. We do it in just 5 doses over 1 week, and because of that, it's much cheaper than conventional radiation therapy.
You don't even take your clothes off. You lay down on a table, listen to jazz music, walk out and carry on as though nothing had taken place. There's no scars, there's no chemotherapy issues of losing your hair. This is all natural hair loss. So I'm about 7 months out from my treatment. At 6 months, my PSA was at 2.2. I'm ecstatic about the whole thing.
We're just trying to get a quick photo here before a horse shows up.
I stay in touch with those guys today, and we all still get together and we share stories.
There's all the boys.
Guys get this ego and they want to ignore it all. It's okay, it'll get better. Get them to go do their test. You are not invincible when you're given a diagnosis of cancer.
Okay, he mentioned PSA level in his blood. FYI, 13 years later, my doctor still tells me that my PSA level is barely detectable. It's so low. And the size of my prostate, he says, is like a size of a teenager or something. But anyway, okay. Okay, now on to the next item. The next item is how to find a CyberKnife facility, how to search for a CyberKnife facility in various parts of the country. I will click on Find the Treatment Center. And let's see. I'll select Filter by Country and scroll down. Unfortunately, the United States is down on the bottom, near the bottom. I'll select the United States. And now you see the whole country basically covered in little icons indicating CyberKnife facilities. Okay, and now in the left-hand side of the screen, an address or postcode, it says. I'll type in Norfolk, Virginia, for example. Norfolk, and then Norfolk, Virginia shows up, and I'll select Norfolk, Virginia. And 200 miles is selected right there, but I will instead select. But first, let me point out on the right-hand side of the screen, you see multiple icons indicating that there's several hospitals that have CyberKnife facilities within 200 miles of Norfolk, Virginia. And towards the left-hand side of the screen, I'll select 100 miles. And that's surprising to me. It zeroes down to just one facility in Norfolk. I thought because of the high concentration of military, that there'd be a lot more CyberKnife facilities in the area. Okay, but back to the left side, I'll X out Norfolk. Now, an address or postal code again, and I'll type in Oceanside. And there's Oceanside, California, shows up in the drop down. And searching within 100 miles of Oceanside, California, there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, about 16 facilities with CyberKnives in them. And let's expand that to 250 miles and see what happens. Okay, there's a bunch more, and there's one in at least one in Las Vegas. Is that Bakersfield, it looks like? Yes. And I'm going to do one more. Cookeville, Tennessee. Okay, so I selected Cookeville, Tennessee just to see what CyberKnives were around there. And let's go within 100 miles. Within 100 miles is 3. There's one in Nashville. There's one in Chattanooga. And is that Cookeville? Yes, there's one in Cookeville right there. The first one, if you look on the left-hand side of the screen, the left-hand side of this video, let's see, there's one that's 0.6 miles away. Now scroll down. The next one is 72.8 miles away. The next one is 77.9 miles away. Then there's one that's, again, 77.9 miles. And also, there's a link, facility website. If I click on it, let's see what happens. And it took me to their website. And I will close that tab out, and there should be information about that website, but I'm not going to get into how to navigate various websites. And also there's a phone number associated with each facility, each CyberKnife. Each hospital has a CyberKnife facility in it. There's a facility website link and a link for that. And there's a phone number as well above the facility website. And apparently, let me see, there's here you can select directions, how to get directions to it from that location. Because I just left that website, now that pop-up shows up to give me offered directions. I will not click on that though. And that's about it for this demonstration. I wanted to show you, give you an idea of how to navigate the Accuray's CyberKnife website on how to find CyberKnife locations throughout the country. We've looked at the East Coast, we've looked at the West Coast, we've looked in Tennessee, and that's the extent of this video. And the hope is that if someone is searching for an alternative to surgery, if somebody is searching for an alternative to surgery, that is having their prostate removed, then I want to help men find that alternative. And it's a great alternative. It's wonderful. It's painless. If not, it's non-invasive. As you saw in the videos, you stay completely dressed. And like they said in the videos, my treatment personally was 5 days in a row. On my way to work, I would stop off at the hospital and lay down for 45 minutes for 5 days in a row, and that was it. The biggest side effect that I had was I used more gas to get to work. And that was it. All right, thank you. That's it for this video. Thank you for watching.